My name is Shannon Bresaw, as Matt mentioned, and I serve as the Vice President of Public Health for Granite United Way. And as part of my role at United Way, we have a contract to help provide oversight to the Recovery Friendly Workplace Initiative. And so I serve as director of that initiative. Jillian?
Great, thanks, Shannon. I'm Jillian Montmarquet, as Matt introduced. I'm the Vice President of Human Resources for MobilityWorks and Diverge Vehicle Innovations. As Matt mentioned, we are a retail location with over 90 stores and 3 manufacturing plants. So we serve the disabled community and primarily selling wheelchair accessible vans. And my hope in partnering with Shannon is just to give a little bit of insight as to how you can take this recovery-friendly workplace and really put it to play in a unique way that's very customizable to your own workplace and hopefully generate some excitement around, our standpoint and the early successes, and again, how it can be adopted as we round out year 1 as part of the program. So Shannon, if you want to go to the next slide, we'll go through the agenda. There we go. So Shannon's going to really spend a bunch of time in the beginning of this session talking through really the data, what the Recovery Friendly Workplace Initiative is, and give us some background as we delve into a little bit about how we got started here at MobilityWorks. We're both going to talk about some of the training resources that are available, how you can really translate those into policies and procedures, and then really what are the next steps for getting started.
So as Jillian mentioned, I'm going to talk just briefly about some of the data and sort of the origin behind the development of the Recovery Friendly Workplace Initiative. You're all businesses from New Hampshire, or mostly from New Hampshire. And so you have a good understanding of the demographics of our state. We're a fairly small state. We're often seen as one of the healthiest states in the nation. We are known for the natural beauty and recreational opportunities within our state. We have the mountains, and we have the lakes, and we have the ocean. We're also known for having a really business-friendly environment, and so no sales tax, no income tax. We also traditionally and over the past several years have had one of the lowest, if not the lowest, unemployment rate in the country. And certainly, that has changed over the last couple of months in terms of the COVID-19 pandemic. So we don't know what that will look like moving forward. But we know in New Hampshire, we have a really high quality of life in general. But with all that being said, we're not immune to the challenges faced by states across the country as it relates to substance use disorder and addiction. So the chart here shows the significant increase that we've seen in the number of deaths from drug overdoses. So we can see from a low in 2012 of 163 deaths, still too many, but to a high of 488 in 2017. There was about a 9% decrease in the number of overdose deaths in 2018, and then again, a slight decrease in 2019, which is not represented here on the chart. So we're starting to see a decrease. Certainly we don't know the impact that the current pandemic will have on the addiction crisis that we face, but we anticipate that there will continue to be challenges, and that potentially some of the progress made will go back on some of that progress. We hope not. So the other aspect of the impact of addiction is the economic costs. There was a 2017 report by Polycon Research, and it looked at the impact of substance misuse and addiction on our state and on our economy. And the cost is estimated at about $2.36 billion per year. And most of those costs, the majority of those costs, are attributed to things like loss of productivity in the workplace and absenteeism in the workplace. So some significant impacts there as it relates to substance use disorder. So Governor Sununu came into office in 2017 with a pretty strong platform of wanting to address the addiction crisis and opioid misuse in the state. And of course, Governor Sununu comes with a business background, you know, a former CEO of one of the ski resorts in New Hampshire. And as part of his role in the business community, he identified these challenges right within the workplace that he was leading, and identified that, and just caring about his employees, identified the need to connect them to supports and people who are really valued employees, but maybe just needed to get connected to the right kinds of support to help to, you know, assist them on their recovery journey. And so in looking at the addiction crisis, one of the aspects that has been a little bit of a challenge has been the involvement of the business community. And I think that over the past several years, I've been in the field of public health and substance use disorder since about 2004 in New Hampshire. And we've always had a little bit of a challenge engaging the business community. And I think it's, you know, a number of different reasons, and we weren't necessarily identifying the right strategies to best engage businesses. What's been really nice about this initiative is having the governor identify this as needing to involve businesses in addressing addiction. So this initiative launched in March of 2018, and the overall goal of this initiative is to promote health, safety, and wellness for New Hampshire workplaces and their employees. And the work that we do is to really empower workplaces to support employees in recovery, but also to support all employees that have been impacted by substance use disorder, because we know the impact that having a family member or a loved one with a substance use disorder can have also on an employee's performance. And so this initiative looks to provide those supports, but also this initiative, a key component is to challenge stigma in the workplace. You know, this issue of substance use disorder and addiction, as well as mental health, there are a lot of stigmas attached to these issues. And one of the core components of this initiative is to start talking more openly about these issues and start addressing these issues head on, using language that is appropriate, using language that's not stigmatizing. There was a study in 2019 by the National Safety Council of US employers. And 70% of US employers identified that they have challenges and have been impacted by opioid misuse among their employees. But only 17% of those employers felt equipped to deal with those issues. And so that's really where this initiative comes into play. And so we're working to provide employers with the tools to help them so that they can focus on what they do best, which is run their business. And we can provide that assistance so that they can help their employees be the most productive employees that they can be, and the most healthy. So this chart shows the structure of the initiative. So this is a governor's initiative. The governor's office oversees this effort in partnership with a number of different public and private partners, and including the Department of Business and Economic Affairs, who's been really crucial to the development of this initiative over the past couple of years, and continues to provide leadership around this initiative. I serve as the program director. We have an advisory council. As I mentioned, Matt is part of that from Hypertherm. We have a number of business leaders who are part of that, as well as folks from the recovery and treatment communities, and also from other nonprofit leaders are part of that council as well. And so they provide some just high-level guidance on this initiative and offer their expertise and insight as we further develop this initiative and move forward into the future to grow the work that we're doing. We have a staff of 3 recovery-friendly advisors, is what they're called. Every business that's part of this initiative is assigned one of the recovery-friendly advisors, and their role is really to help guide the businesses through the process of becoming recovery-friendly and kind of identifying what that means for that business, which could be really unique to that business. And so the recovery-friendly advisors really customize the approach and get the businesses connected to the resources that will be most helpful. And we kind of, we sometimes refer to them as the concierge to the community, which is really what they are. So we provide support to the workplaces. We currently have 269 workplaces that are part of this effort. We have, one of the commitments that we made in establishing this initiative was to rely on existing resources and really leverage those existing resources. So we have 13 public health networks across the state that cover the entire state. And those consist of dedicated staff members who work on prevention strategies and addressing the full continuum of care as it relates to substance use disorder. So those folks are resources for the business community. In addition, there are a number of recovery community organizations across the state that provide direct recovery supports to folks, peer recovery support services, telephone supports, trainings, just a number of different opportunities for people to get connected as they make their way through their recovery. And so what we've done is really to leverage all of these relationships as best as we can to really make the experience of the businesses that are part of this effort a positive one. So these are some of the accomplishments we've seen over the past just over 2 years. We have been able to secure funding for this initiative from a number of different sources. We've developed a comprehensive training menu, which I will touch upon later in the presentation. We have awarded $900,000 in some of the funding that was appropriated to this initiative to our nonprofit prevention and recovery partners to support this effort. We certainly have our logic model, our evaluation plan. We're currently engaging 269 New Hampshire businesses. We started off with 25 early adopter businesses, many of which I'm sure are very connected to this organization because they're really, proactive when it comes to social responsibility and health and wellness. And so that has really grown substantially over the past 2 years to now that 269 businesses representing over 70,000 employees. We have, through our staff, directly engaged over 7,000 individuals in our outreach, our presentations, our trainings within that 2-year time frame. And actually, it's really just over a year because it took about a year to secure funding and to hire staff and to pull all the resources together and the training modules and get the program up and running. So that engagement has really been over the past, I would say, year and a half. We've also provided guidance and support to a number of different states, counties, organizations across the country. I'm in close contact with about 15 other states that are replicating aspects of this initiative. And one of the things that I personally love about this initiative is just the willingness of the governor and leadership to share all of what we are developing here. Because the way we look at it is, if we want to really address stigma, and we have to make this a movement. This can't just be happening in New Hampshire, it needs to be happening across the country. And so why reinvent the wheel? Let's share what we've developed. And that's really the spirit of this initiative right here in New Hampshire as well, in terms of business leaders sharing with one another. And you'll hear more about that in this presentation as well. And then in terms of one of the ways that we've had to really pivot over the last couple of months, as all businesses and organizations have had to do in response to COVID-19, is, a lot of the work that we had been doing was really in person. So you'll hear more about the process of becoming designated, but there are things like our trainings and presenting our designation certificates and orientations, and that was all done in person. And so we've had to, pivot to doing all of that virtually, which has been pretty seamless. And the other thing that we've done is we have started to offer a weekly virtual training series. And we've really just right now publicized that for our existing workplaces, but eventually we'll be opening that up to other businesses as a way to obtain, interest from new businesses to become part of the initiative. But we've had a number of really successful training opportunities thus far, and really identifying how best to support employers and employees when they're in this stay-at-home situation, or when there have been furloughs or other impacts to their business and to the workplace. How can we best support employees during that time as it relates to their recovery? And so we've been offering, a number of different trainings in that respect, and we're continuing to offer those throughout the month of June, and that will probably continue in the future as well. We have been really, trying to ensure that we're collecting data. We collect all of the data concerning our trainings, our outreach, all of those engagements that I mentioned. We're also tracking the level of business engagement. And so this is looking at how does the level of engagement of businesses change throughout their journey with us on this initiative. So we look at what are the intentional efforts on the part of the workplace to address the impact of substance use disorder and stigma in the workplace. How are businesses intentionally supporting employees in recovery and those impacted by substance use disorder? And we're measuring that over time. We track that on a monthly basis. So we're in the process of analyzing that data, but we anticipate seeing, just a meaningful increase in that engagement as this initiative moves forward. We have all of our training. Oh, I forgot to do the question on one of the last slides. Sorry about that. The question that has just popped up for the poll is, do you work for a recovery-friendly workplace? And so that, I don't know if I think the poll's still active. So that has just popped up. So we evaluate all of our trainings. We have pre and post surveys for businesses that we are working on, collecting some other data. And one of the things that has been the most powerful aspect is really hearing from businesses that have been part of this effort to hear about their experience and what they're starting to see in terms of changes within the workplace after implementing this initiative. And you'll hear certainly from Jillian and at MobilityWorks about some of those changes that they're seeing. But we're starting to hear from businesses that they're seeing a change in the culture within the workplace and the willingness of people to talk more openly about substance use disorder. Some are even reporting changes in increases in productivity and decreases in absenteeism that they are attributing to working on this initiative. And so we're going to continue to track those, but having those business champions has really been one of the keys to success of this initiative thus far. There we go. So just some lessons learned from this initiative. So I think there's some key components to success. The successes we've seen, as I mentioned, the business champions is really crucial. Having that top level leadership is also really important. I talked to other states and they can't believe the involvement that we've had from our governor in this initiative. You know, just right down to really, you know, doing whatever he can to support this effort and promoting it when he visits businesses, to really looking at this from using his business lens to say, let's make this process simple for businesses and doable, but still meaningful. And so it's been nice having that leadership and that support. It's been just, you know, really crucial to this work. It's been really important to develop partnerships, strong partnerships, connect businesses to local resources. So there are a number of prevention, treatment, recovery organizations that most businesses know nothing about. They're not familiar with the resources available, which I understand. They're running a business. And so, you know, I feel it's our responsibility to get them connected. And once connected and they have that relationship, it's a lot easier to connect their employees. Having a simple process, I'll talk a little bit about the checklist moving forward, but having a simple process for this initiative has been really important. And it's not just top-down support, it's bottom-up support. So one of our recommendations is always to have either an existing wellness committee add this recovery-friendly workplace as part of their mission, or establish a recovery-friendly workplace task force where you have employees that are helping to spearhead this work and helping to drive decision-making within the business as it relates to this work. That's been really important. And then some challenges. As with any new initiative that's being developed, you know, you're always looking to ensure adequate funding. You're always looking to ensure you have the capacity to meet these needs. You know, the businesses that have been involved in this has just increased substantially. And so we've had to really make sure that we have the staff in place to meet the needs of the businesses involved. It's always a challenge to coordinate complex partnerships. You know, we have to make sure that everyone kind of understands their roles and responsibilities and that we're, you know, not duplicating efforts, we're not stepping on toes, we're really leveraging and aligning resources when possible. So it's a challenge, but I think that we've done a nice job with that, you know, given the challenging landscape around that. And then just in general, challenging stigma and discrimination as it relates to substance use disorder. It doesn't change like this, doesn't happen overnight. And so, you know, it's going to take time, but we're seeing, you know, baby steps. We're seeing, you know, stories here and there and starting to see changes reported to us from some of the businesses. So it's nice to be part of that, but it remains a challenge. The checklist that I have mentioned is a one-page document. And if you want to know about this initiative, you really just need to take a look at the checklist. We really wanted to make this process simple and straightforward for businesses. So the steps of the checklist are pretty simple. Companies interested in being part of this initiative can submit a letter of interest. It's a simple form on our website, recoveryfriendlyworkplace.com. And after submitting a letter of interest, we share we assign one of the recovery friendly advisors to the business. And we also generate a letter directly from the governor to the business joining the effort to welcome them as part of this initiative. The business then meets with our advisors and has an orientation, and we require that senior level leadership be part of that because, again, having that support from the top is really important as it relates to, you know, policy change within a company and really culture change. You've got to have that top leadership support. And then we ask the business to make a declaration to all employees and identifying what it means to them to become part of this initiative and what their commitment is to their employees as it relates to this initiative. Upon those steps, we issue a designation, and that comes from the governor. It's a certificate of designation. And then the business is recovery friendly. We add them to our website. We share with them our logo. And then within the next year, there are some additional steps that have to be completed in order to maintain that designation. So that includes connecting to recovery organization, providing information and resources to employees, participating in an education or training opportunity, and then there are some optional activities here as well that I've mentioned. And so I'll turn it over to Jillian.
Thanks, Shannon. Looks like we've got a number of people on that are recovery-friendly workplaces and some that aren't yet, but hopefully are sparking some interest. So as we move through the remainder of the presentation, please feel free to share thoughts, comments. Each one of our experiences certainly has been unique, and so hopefully you can relate to some of the things that I'm going to share that we've been through. So how did we get started at MobilityWorks being recovery-friendly? Big thank you to the NHBSR, your spring conference last year. I attended for the second year, and you know, was convinced to stick around for the meet and greet for a little bit, primarily because there was a little ticket in my pocket, but that's all fine. You know, kind of went in there, and as I'm standing with the colleagues of mine that I came with, this woman came over, Karen Morton-Clark, who's one of the recovery-friendly advisors, and she introduced herself, and I thought, oh, this isn't going to work for us. So I thought, how do I professionally dismiss her? Because we're safety sensitive, we serve the disabled community, and certainly we're a drug and alcohol-free workplace. So I thought of the kindest way I could say that, so she'd move on and create a connection that actually would mean something. And she said, well, let me just ask you one question. Do you care about your employees? And I thought, well, that's an odd question. I don't know how any good HR person, you know, couldn't answer that with, yes, of course we do. You know, one of the things that I always tell people, one of the greatest parts of my job in working for MobilityWorks is how much we care about people. Out of the other side of my mouth, I'll tell you one of the most challenging things about working for MobilityWorks is how much we care about people. For those of you that are HR reps, you know, we live in a world that's really black and white, and we like rules and standards, and we like, you know, equity amongst all of our decisions as we make them. And so personalizing and figuring out how to work in an environment that is so kind of inclusive and understanding can really pose unique challenges for setting precedents, you know, liability, et cetera. And then certainly gaining, you know, buy-in from the top, as Shannon spoke about. So, you know, we kind of shared a laugh, and Karen convinced me to let her come back and talk to us a little bit more about what it meant. So June of last year, she visited the office, and really what it came down to was providing resources. And Shannon mentioned a lot of what the program aims to do. It's exactly what they do. Try to connect businesses with resources that can actually help. And certainly that was intriguing. So kind of left that meeting and went to the executive team and talked about what does this mean, and is this something that we think we could tackle? The process seems easy enough. The checklist is easy to digest and understand. And lo and behold, we were going to have Karen by our side the entire way. And just about unanimously, the response was, well, absolutely, we want to be a part of it. This speaks to the culture that we've been working towards, which is, in part, caring and character building. So certainly that relates to the population that we serve, but our team members nonetheless. So with their buy-in, we quickly made our declaration, which you can see on the screen. We're committed to creating a healthy, safe, and stigma-free work environment. As part of our commitment, we voluntarily chosen to participate in the New Hampshire Governor's RFW program. The initiative encourages collaboration between employers, employees, and their communities to create positive change and eliminate barriers for those impacted by addiction. Our hope is to look for similar opportunities in each of the states in which we operate and advocate for programs in those where they are not available. We invite and encourage all employees to reach out for help and support. And we published that, and real quickly our Social Responsibility Committee kind of adopted that and started fielding lots of questions for others who had immediately bought in and wanted to get behind this initiative at our company. So easy enough, now what? Well, the now what and the next steps really is how do you customize a program that's going to work for your workforce? So we met to kind of go through the checklist that Shannon shared and really talk about how do we best customize. And I'm going to kind of harp on that a lot because the program that works for us might be different for you. But really customizing a plan that's going to work for you and your team and really getting the process started for how to breathe life into the initiative. So as we move forward, Shannon's going to share how that process starts. And then I'll give a little bit of insight of some of the things that we experienced and what we've been able to develop as a result. So go ahead, Shannon.
So in terms of when we were establishing this initiative, it was really, really important that we understood what the needs of workplaces were. So we spoke with a number of different workplaces. We spoke certainly with all of our 25 early adopters, but really reached out to a number of different business leaders and organizations about what their needs were related to these issues. And not surprisingly, they really, really vary. They vary based on the size of the business, the type of the business, the culture of the business. Businesses are at all different levels of readiness to engage on this initiative, and that is okay. We totally recognize that and believe that this is a continuum. And so our job is to work intentionally with businesses along that continuum. And so it doesn't matter where businesses are at in terms of any of those factors, we will work with those businesses to customize an approach that's going to be effective for their particular business. So with that, though, there are some, shared needs that come up, and that's, there's an identified need to access trainings for supervisors and employees on issues related to addiction and stigma, and that will, and that's how we sort of informed our training menu, which you will see in one of the next slides. Businesses want examples of recovery-friendly policies and procedures, and this has been really, really nice to have the business champions that we have, because they are sharing, their policies and procedures. They're sharing things that have worked for them and areas that have been challenges. And so it's that sharing of resources in terms of from business to business that has also been really powerful. Businesses often have identified, the need to connect to community resources. We hear from businesses that they, aren't aware of the resources that exist, and that they not only want to support their employees, but they want to support their employees and their families. And that's been really crucial in the development of this initiative. We've been really proactive in offering resources and supports that also identify supporting family members in addition to the employees. Businesses are, looking for recruitment retention strategies to keep a healthy, safe, and productive workforce. The customization piece is crucial. I don't need to go into that much more. And just, a clarification on what it means to be part of this initiative. So, starting off, we have businesses that think about recovery-friendly workplace and think that automatically this means I'm signing up to always hire people in recovery, and that's not what this is about. You're already employing people in recovery, certainly, but as I mentioned, this is a continuum, and so we meet the business where they're at. So just when businesses get that level of understanding about what this initiative is about, I think there's more willingness to engage in this process, because we're not trying to tell a business what they need to do. We're trying to work with a business to bring them along this continuum of implementing more recovery-friendly practices. So this is the training menu that we have developed. When we first launched this initiative, businesses were really interested in the training modules right away. And so we had to quickly develop the first original set of training modules. And then we were able to engage a consultant who really worked with recovery experts across the country to develop the newer modules. And the newer modules were developed with the intention of sharing those modules. They have training guides that go with them. So they're kind of plug and play in terms of trainings, and those have been really helpful to share with other states who are looking to replicate this initiative. But these are some of the topics that have been, that come up where businesses are really interested in, and we've received a lot of positive feedback about these topics. So just understanding substance use disorder and stigma, so just in general, how to access resources in New Hampshire through 211 and the doorway system. That's been really powerful. Saving a Life with Narcan, where we partner with our public health networks and doorways in our regions to offer Narcan kits on site. And I've been really impressed with the number of businesses that want that, where they want Narcan on site. So those are some of the examples of the training modules. There's a lot of what we do in terms of businesses sharing with businesses. So we have business panels where we share resources and information, and we do other panel discussions as well. And as I mentioned previously, we're moving towards offering trainings in a virtual manner, and we'll be developing those with a number of different topics as the needs are identified.
Great. So we talked about, kind of next steps and going through training and what does that look like. Certainly we partnered with Karen, as I mentioned before, and really started looking at how do we design a training that would really meet us where we're at. So Shannon talked about meeting the business where we're at. Who was going to be involved in that? We chose to include the HR team, our Social Responsibility Committee president, and local store management. We have the pleasure of having our corporate office above one of our stores, and so we thought, why not get some early buy-in from a field representative? So we really went back and forth to say, we don't have time to do all the modules. What's the most impactful, and how do we think we can make the best out of the first day? And so you can see on the screen, we came to learning objectives that took a little bit from many of the trainings that are available and kind of pushed them together for an impactful session. And Karen then took it the next step and said, okay, well, how do I fill the room with others that can contribute to this conversation in a very impactful way? So we ended up with state resource reps, employer representatives, lived experience panelists, so on and so forth. And so starting this, and I want to give you guys a real insight as to what exactly does this look like and how does it feel and what does it mean? Coming into it, and Shannon, close your ears for a quick second, I thought, this is a state-run program. How good can the training really be, Am I going to give up a whole day of productivity with arguably my whole team for something that I have no idea how this is going to turn out? But I figured, you know what? We made a declaration. Let's take a leap of faith. And we did. Kind of really thrilled to report that what we actually got was completely the opposite. We started learning about substance use disorder and insight into some of the facts on the epidemic and what does that really mean. It was no more than 10 minutes into the presentation when we kind of looked at each other across the room, the HR group, and started smiling, because much of what you heard Shannon talk about and you'd hear in that training is really people first language. And in our world, we deal with people with disabilities. And so we spend a lot of time talking about people first language and how to relate to people and reduce stigma. And so in a weird way, we made kind of an immediate connection to, okay, they speak our language. This might make more sense than we originally thought. So we moved through some of the presentations. We had representatives from 211 available. And again, you know, we had this aha moment. And our general manager of the store actually said, well, wait a minute. 211, I hope we're listed as a resource, because we live to serve the disabled community. I want people who call in to know that we're here and we can help. Oh, and by the way, can we get cards for our showrooms and our waiting areas? We think this is a great resource. We want to share this with not only our team, but with our customers. And so the conversations kind of slowly started evolving and getting more and more involved. You know, Matt, I wasn't going to totally throw you under the bus, but Matt was in that session as an employer representative. And so he was able to speak to Hypertherm's journey and what did that look like and how they develop resources. And from a liability perspective, he got lots of questions around the how do we implement, how do we, you know, stay safe, what do we do about setting precedent, how does that work being a drug and alcohol-free workplace, and really got to, in real time, gain a lot of understanding on how can we really give life to this outside of the room. And then they rounded out the session with a lived experience panel. And we were lucky enough to have a team member of ours and her daughter speak. We also had others in the room share. And Karen kind of asked the question and said, you know, do you mind if we take some time to go around the room and really understand how substance use disorders have impacted the people in the room? And I said, okay, yeah, that sounds good, thinking that I've been working with these people, most of them, for over 8 years now. I generally know everything about them, their families. I know what they order for lunch when we order. But yeah, okay, I don't think we have that big of an issue, but let's do it. Well, no sooner did the first person start talking and there wasn't a dry eye in the room. Every single person, without fail, had a story about how they've been deeply impacted by substance use disorder, whether in their family, someone they knew, them themselves. And it was like astounding. I thought, wow. This issue that, you know, the recovery-friendly workplace is trying to bring to light, by way of movement, it's real, and it's here. And I didn't even recognize that it was right in front of me. And there is so much that we need to be doing for our team if we're truly going to support them in the way that we claim that we do. So, you know, we ended the day and just felt like it was one of the most powerful sessions that we had had. And I thought, well, missed opportunity. I've got HR people all over the country that probably should have been in for that training, and we need to redo that because it was just such a positive, powerful moment. So as a group, we kind of started thinking about, you know, this on a larger scale. And truly, if this many people in our home office have been impacted, how about across the company? We have 1,200 team members. How many other people are facing things that we don't even recognize that they are? And quite frankly, we've almost dismissed conversations about it because we're so safety sensitive. So I'm sure everyone's got stories, but you know, the first that came to my mind was a really recent story about a long-term team member of ours who, you know, he had been with us for over 10 years in a leadership position. The guy had picked up his whole family, moved across the country, would do anything it takes for this company, kind of bleeds our core values. He's also a high producer, so really well liked. He ended up with a substance use disorder, and that was reported. And, you know, initially at the time, my first reaction was, well, unfortunately, we have to part ways. You know, it is a black and white issue, and, you know, we need to terminate employment. I don't want to set that precedent. I don't even understand how much I can get involved. What if the team knows? I start going down this path of there's so much liability around this, and we're not really prepared to deal with it in any other way than to say goodbye to kind of a long-term team member. So kind of talking with my operational partners, we ended up as an executive leadership team really talking about it. And what was interesting about that discussion and how do we respond was about half of the executive team said, yeah, there's no question. Certain policies, you don't cross certain lines. It is what it is. It's unfortunate, but we didn't make the mistake. The other half had this real but this is a long-term team member and there must be something we can do. How can we support him? I don't want to turn our back on him in this time. We know the family. What exactly legally are we able to do? And this went back and forth for a few days, and ultimately we ended up working with this person. Thank God we did. He's a contributor today. But really it was uncomfortable, and it was uncomfortable to have the conversation. It was uncomfortable to pick a side, so to speak, on the decision. And I think there are so many of those type of employee relations situations that happen every day that between HR and whoever the leader is in the company, we're trying to figure out how do we best deal with this and what's the right decision for the team member and the company. Boy, had I had the resources that I have now, the conversation would have been a whole lot different, and I would have been able to be a better coach, a better guide, and really better advise the company on exactly what it is we can do. So Shannon, if you want to go to the next slide, and again, a lot of these policies were really borrowed from those that I've mentioned earlier. We didn't come up with them, but certainly we adopted them. And so those discussions translated into us developing these policies and procedures to address just that. What do we do when someone comes forward with an issue? What do we do when we suspect that there's an issue? What do we do to give people more resources than just the employee assistance program? And so, it really did become about the resources. And how do we develop our, what we're calling the substance misuse agreement? Again, thank you, Hypertherm. How do we link that to the the employee assistance program? How do we make commitments to team members? How do we ask them to commit to their own health? How do we track that? What does the referral program look like? And how can we set a standard for all those that are affected or might be? How do we guide our field leaders in responding to these issues that likely are coming up every day and we may not be hearing about them at the corporate office? So these documents have been shared in the chat if you guys want to take a look at them and certainly adopt and modify them as you see fit. I have to pay it forward given that that happened for us. But really from a legal and compliance continuity and documentation perspective, the HR side of me, it felt really good to have these resources available and to know that we weren't going to have these debates around the person and the individual circumstance, but we had tools that we could very easily put into motion to respond to people. So, again, I mentioned it earlier, there are many of you that responded to the poll question that you're a recovery-friendly workplace. I know your story is unique. Feel free to network. Make sure you take advantage of those discussions. People are willing to share. They'll share the good, the bad, the ugly, as I have. And certainly, we can work together to really make this an initiative that is lifted off the ground and that we can kind of win over hearts and minds and get people to recognize that, just like us, this issue is real, it is in our workplaces, and we need to do due diligence to be able to address it. So with that, Shannon, we can go to the next slide and we can move to a little bit of a Q&A session. I'm sorry, before that, Shannon, if you want to take us through getting started, and then we can jump to Q&A after that.
Sure. Yep. Thank you, Jillian. So in terms of, if you're a business and you're kind of thinking about how do I get started on this, I'm not sure if we're ready to go down this path or not. These are some recommendations on how to get started. And what's interesting is that it really follows our checklist. So I would say, even if you're, thinking about getting involved, but you're not sure whether it would be a fit, I suggest submitting a letter of interest on our website, because we will put a recovery-friendly advisor in place with to work hand in hand with your business to kind of explore some of these areas. But some steps would be to really look at your existing workplace culture. Like, what do you think your staff and what do you think your leadership is ready for in terms of these issues? Communicating a commitment around these issues and about talking more openly about substance use disorder. Something as simple as, getting the 211 information referral line, posted on a, electronic resource, sending it out by email, sharing with employees on bulletin boards, on a website, rack cards, things like that. Connecting with the local nonprofits that provide recovery and treatment and prevention services. Having a plan or policy procedures in place so that supervisors feel confident that they know how to respond when concerns come up. Starting to offer trainings is another step to just increase that knowledge and awareness. And then, one thing that I recommend, and I've talked about it already, but creating a task force that can work on some of these issues. And then you're not doing it alone as a leadership team or as HR, but you have a team behind you working to develop this.